This is the Project Dawn program. My name is Casey. Thank you all so much for having me. I'm here from the health department. Project Dawn, like Mary said, I'm just going to quickly reiterate. It's deaths avoided with naloxone. It is a community-based overdose education and naloxone distribution program. So through Project Dawn, participants do receive training on recognizing the signs and symptoms of overdose, distinguishing between different types of overdose, performing rescue breathing, calling emergency and medical services, and of course, administering that naloxone. So why should we distribute naloxone? It's really important. It's plain and simple. More access to naloxone means more lives saved. It's free to clients. It would be free to your agency if you are interested in having your agency have naloxone on hand and or becoming, like Mary was saying, a distribution site. So again, distributing naloxone initiates that conversation and that communication. And of course, more individuals will have access to naloxone. So I'm here today to talk to you and your agency about becoming a distribution site. If you're interested, my contact information is on the last slide, and I'd be happy to talk more to you directly about what that would look like for specifically your agency. I just wanted to share with you our current partners. Mental Health America of Licking County. Inside that building is Genoa Pharmacy, as well as Behavioral Healthcare Partners in Shepherd Hill. Actually, all currently have our naloxone kits and are providing them to Licking County residents. Our other partners include the Main Place, Trinity Episcopal Church, the library in downtown Newark, and Licking County Alcohol Prevention Program. They actually, like I said, allow us to come distribute naloxone on their property, and our distribution partners are actually trained to distribute for us. So you can be added to this list if you're interested in, making your agency become one of those. You should see in Licking County these little green free naloxone kit cards floating around. Our goal is to get out and, share about those. I also just wanted to briefly share what's happening here in Licking County. I know there are other counties on the line, but like I said, we have finalized some of 2020's numbers in overdose fatalities. And you can see here what they look like. The 2020 data, of course, does have a stopping point there. We're not clear through 2020, but so far there has been 26 overdose fatalities. The next slide that I wanted to share is a breakdown of 2016, 17, 18, and 19. And as you can see, the fentanyl and the fentanyl analogs have such a high prevalence rate when it comes to those fatalities. I felt like this was really important to share. And again, this is only in Licking County. I would encourage you, those of you who are outside of the county, contact your local health department. They may know these numbers because it is, I think, important to note and important to talk about. That way initiatives like Project Dawn can be recognized and talked about because they are important. But as you can see, that fentanyl and fentanyl analogs do have such a huge spike, especially in 18 and 19. I can't exactly give you a number for 2020 yet, but I do know it is still pretty high currently for those overdose fatalities. So that's what Project Dawn is aiming to do, really lower these and, get naloxone out there. It's the first line of defense when it comes to these overdose fatalities. I just wanted to, again, briefly talk about what's been happening. Like Harm Reduction Ohio, we started this grant in July of 19. And since then, we've given out 774 kits, which is a little over 1,500 doses of Narcan. 894 individuals received education. We know of 73 overdose reversals, and that number is hazy at best. We do collect some of that information on that intake form that Mary was talking about. It kind of goes along with our demographics. And we know that it's, hazy at best, like I said, but in my head, it's really awesome to know that 73 people got to celebrate another birthday. They got to, you know, celebrate 4th of July again and Christmas, and they got to maybe see their kids graduate, or maybe because of COVID, maybe virtually graduate. But 73 people got to live and see another day because of the kits that were distributed through the Project Dawn. And I think that is such a huge achievement and something to be recognized. So I, you know, love to share that information with as many people as I can. 30 plus agencies have been trained through Project Dawn. So the next steps of what it could look like for your agency, we would put in a participation agreement, we would train your staff, we would provide you that naloxone that you would provide to your clients, and then all you would need to do is provide that paperwork. Oh, I misspelled that. It says proper. Yep, proper paperwork to us back, the paperwork that Mary was talking about earlier. We too have an online mail to order program. It is just for Licking County residents. However, there are services all over Ohio. Clearly, Harm Reduction Ohio can mail to you anywhere. And all you would need to do is get on our website. I just wanted to show you what that looked like while I have my screen shared. When you go to our website, which is lickingcohealth.org, you would scroll down, you kind of hover over our programs. It would be under this health promotion and then the drugs and overdose prevention. Or if you're on our homepage, it's actually just conveniently at the bottom right here. So it's pretty cool. You would just say request a kit. It would take you to that short training. You would put in your county, but like I said, only Licking County residents are eligible here. But if you were to put in a different county, it would actually show you where to go to find where your county is. Whoops. So what you would do is it would take you to the Ohio Department of Health's website. I even Googled Project Dawn. Whatever way you get there will work. You would actually get to this web page. It's an ODH website, and you can actually find the list of Project Dawn sites in Ohio. So if you click here, look, Harm Reduction Ohio is actually the first one, but you can look by name of county. So if you clicked on L for Licking, you would see, maybe if it's going to load, all of the L counties and then all of the places. So on here, as you can see, like Mental Health America, Genoa Pharmacy is on here, Harm Reduction Ohio is on here again, and so are we. I'm pretty sure I saw somebody on the call from Muskingum, at least Muskingum. So as here you can see, Zanesville-Muskingum County Health Department is a Project Dawn site. From there, an individual could contact and request a kit that way. So to jump back to this, like I said, this was pretty brief. I just also wanted to share with you, I think I already did a screenshot of that. Here is my cute dog I like to share, and my contact information if anyone would like to email me and see what that could mean for your agency. I would love to get to know you and your agency and see how Project Dawn could benefit you and your clients.